Hey friends, welcome back to the channel. If you're new here, my name is Paul, and I pretty much like to go over things that I'm curious about and the things that I've researched or looked into, I like to share on this channel. So today, what I want to be talking about is trauma. And in specifics, I want to talk about what I have learned very, very recently in regards to how it has affected health overall. And maybe I will do an episode coming up on just like more of what I've learned about trauma itself and how a lot of us experience different versions of trauma in childhood or early adulthood, and what signs maybe we should look out for and whatnot. But for today's video, I wanted to talk about what I have learned looking at myself, learning, trying to understand health, trying to understand where different things come from on my end as far as health problems or behavioral and things that I want to change, and looking at root causes and whatnot. So the biggest thing that I have learned so far is when you are in a traumatic scenario or when you experience trauma, you are put into a fight or flight mode. Most of us have heard that term before, fight or flight, right? It's the run away or it's the, fight and, go up against the aggressor and whatnot. There's a third option that I have learned about myself. This one is called the freeze mode. And the best way that I heard it explained was, if you've ever seen when an animal gets caught by like a cheetah or by a lion or whatever, and that animal is just looking. They're not fighting anymore. They're just looking dead out into space. They're getting bit. They're getting gnawed. They're not reacting at all. They're not fighting, and they're not feeling the pain. What I learned is that what this animal is going through is called the freeze mode. And literally, their brain is going into such a protective state to dissociate any feelings that they have, anything that they are going through in that moment because it's trauma. To me, this was an epiphany. Why? Because one, if it gets severe enough, this is actually shown within people, you can actually turn off a lot of sensations. So, I'm not just talking about emotional here, which I'll get into that in a second, but physically, you can actually turn off physical sensations based off past trauma because your brain doesn't register it. This is what oftentimes can happen with rape victims. This is people have that experience, and then anytime it's the touch or they just get numb, they don't feel nothing like that, no pleasure, no nothing. It's literally just nothing. Now, I have personally experienced mine more on the emotional end and seen how I can go into when I look back on myself, I'm like, okay, I was one of the most empathetic, caring, all these things that I found myself naturally doing. And then I've seen in these past 3 years a big change, and I saw a lot more apathy enter my life. Apathy is when you don't care, like you literally don't care at all. And it's one thing sometimes people say, oh, like I don't care, whatever. But this is when people say, you're dead to me, I feel dead inside. This is putting words to what is literally or can literally or has literally happened in the brain because of a traumatic experience. This is insane, and this is mind-blowing to me. Because when I went back and looked back on different experiences, what caused some of these things for me, to me, so many things made sense. Now, that's something that I can continue on for a while, to be honest with you. But like I said, I may leave that for another video in terms of more things to look for. Here's where I wanted to get into the health side of things. So when we get into that fight or flight mode, that is activating our autonomic nervous system, okay? Essentially, what that is your sympathetic nervous system and your parasympathetic nervous system. What that means is when you're in a stressful situation, okay, that adrenaline gets released, that cortisol gets released, your heart rate gets raised, and you are in a stressful mode. So you're only, your brain is pretty much telling your body the only thing that you're looking for there is survival, okay? So when survival is the only thing that your brain is saying to go on and to do, that is putting a stop on all the other normal systems in your body that would normally be running in the rest and digest phase, which is in your parasympathetic stage, which when you're calm, it's when you're relaxed, and what tends to be associated with that is your lower heart rate, higher HRV, heart rate variability, and you are calmer in breathing, so you're not breathing as many times per minute. Okay? So, taking those factors into consideration, this was a huge insight for me. One, because when you realize when you are in fight or flight mode, in your sympathetic state, this can cause an onslaught of a lot of other illnesses because you are, without even realizing it, you could be adapted to a higher level of stress without even knowing that you are stressed out. But compared to like where you should be, you are actually stressed out. But you don't realize it because you've been this high for so many years. So you may say your heart rate is whatever, when it really should be, 10 or 15 beats lower. But you don't realize it because you are constantly in that stressed out and paranoid state, and you haven't even realized it for decades. The kind of effect that this can take on your health is insane when you think about it year after year after year, or decade after decade after decade. Then on the flip side, because the body, what the body does if it's in this parasympathetic state is it naturally heals itself. You have a cut, you see the cut gets healed. Okay, that's what the body does, internally and externally. And when I realized this, that the basis, or a huge basis that a lot of people aren't even considering, is literally stress, which a lot of stress can come from past trauma, which is why I brought it up. This is something that I think that a lot of people need to look into, and that I think a lot of people need to start focusing on. And the number one, I guess you would say, treatment, maybe not treatment, but a thing that can help this is breath work. And this is what's crazy to me, is that, okay, here's something that's going on in the majority of us. In some way, shape, or form, trauma has entered our life. And we are in more stressed out stages than we even realize. We are breathing faster than we should be. We are having higher resting heart rates, and all these things are going on that we don't even realize. And a thing that we can do, one of the things that we can do to help fix this, to help get our health back in line, is simply breath work. Now, what type of breath work? This is when you you could mix it up, but this is when you want to get into the calming type of breath work. The type of breath work that you're going to be doing, maybe the box breathing that I've talked about earlier, that 4-4-4 type of work that you can do to bring your heart rate levels down, and to just start training your subconscious mind that breathing less times per minute, optimizing how to breathe more and whatnot. But anyways, this is just a beginning of the stuff that I have begun to look into, and that I have been kind of mind blown over, because I think if more people were to really look into their past, they would see at some point they've had trauma. And when I learned about that third option, fight, flight, or freeze, to me, it opened so many doors to me. That freeze mode, that dead mode, that I don't care mode, that avoidance, all these things. You see the stress comes whenever you're in the situations again, and then boom, you go to that certain mindset. You maybe have your vice to go deal with things. Like literally, so many people are acting subconsciously and they don't even realize what's going on. And most things you can trace back to what happened. If it's not in childhood, at least it would be early adulthood, because of some type of trauma that happened. It's crazy to me when you think about this. This is why I love reading. Literally, I feel like I have new epiphanies that come, and more things that I learn about myself. And so anyways, I just wanted to record this video. I hope it helps someone. If this sounds like it's even coming close to something that you may be experiencing or have experienced, let me know. And if just start looking into this. Start tracking your resting heart rate. Start tracking how many times you breathe per minute. I wear a Whoop strap, and they they do record those things. So that's what I have looked into for myself. And like I said, just doing some of this research on my own has made a lot of sense to me. So I hope that this is at least a good starting place for you, at the very, very least, for you guys on your health journey, physically, but 2, emotionally, 3, mentally, all of the above. So Yeah, I guess I will see you guys on the next one. And again, let me know if this helped at all. Would love to know.